Top story tonight, though, a push to make coronavirus vaccines mandatory. North Carolina's largest hospital systems say they're forcing all of their employees to get vaccinated for COVID-19 following other hospitals across the country. But this has been a point of contention for those places. In some cases, healthcare workers have been fired or walked off the job. WCNC Charlotte's Hunter Sines joins us with how it will all work here and the threats that come with it.
Novant and Atrium are now forcing their employees to get vaccinated. Caramont Health and Tryon Medical Partners aren't doing that yet, but top health officials say it's important because just this week, North Carolina lost 3 medical workers to COVID-19.
It really is an important time for us to take this step.
As COVID cases and hospitalizations go in the wrong direction, a number of Tar Heel medical providers taking a stand themselves. Atrium Health announcing all 70,000 employees at its 40 hospitals must be fully vaccinated by October 31st. Novant Health quickly following suit, forcing all 35,000 employees to be fully inoculated by September 15th. If staff refuses without a medical or religious exemption, they could be fired.
We want to make sure that when you come to a hospital, you don't get a disease that we can prevent with a simple vaccine.
Cody Hand is with the North Carolina Healthcare Association that applauded the new requirements.
The vaccine is safe, and we think everybody should get it. And if we want to ever get over this pandemic, we all need to do our part and get our shot.
But not everyone in the medical field is on board, including some nurses who have locally posted this picture to Instagram that's gone viral nationwide. Reading, "A year ago, nurses were called heroes. Today, many are being fired for making a personal health choice. I stand for freedom, not force." Last month, Methodist Hospital in Houston fired or accepted the resignations of more than 150 nurses and staff members for not getting COVID shots.
At a time when we have case numbers going up, hospitalizations going in the upward direction, is it worth the risk to possibly lose some of our critical healthcare workers with these type of requirements?
I think the risk of losing them to death from COVID is even greater. And so I would say no, it is definitely worth the risk of losing staff who just aren't willing to get the vaccine.
I reached out to the North Carolina Nurses Association. They tell me that they have not voted to support or oppose these new requirements, but that vote could come from their board of directors as soon as next week. The American Nurses Association does approve of these requirements, saying nurses have a professional and ethical obligation to lead by example. In Charlotte, Hunter Sines, WCNC Charlotte.
Hunter, thank you. And we ask health providers just how many of their employees are already vaccinated. Novant tells us 67% of their employees have had at least one shot. A spokesperson, though, tells us they're having a hard time getting Black and brown employees vaccinated, as well as younger employees. Novant Health did say 95% of their physicians are fully vaccinated. Tryon Medical Partners say 87% of their employees are fully vaccinated. Atrium Health did not answer our question when we asked how many of their employees are inoculated. And now, with this story in mind, a lot of you have been asking us on Facebook whether employers can legally require workers to get the COVID-19 vaccine. We want to verify for you tonight. According to the U.S. Equal Employment Opportunity Commission, an employer mandating a vaccine does not violate federal law. However, if a worker cannot be vaccinated due to a religious or health reason, then there would be a legality for employers to exclude the employee from the workplace, but the guidance says they would need to make alternative arrangements for that worker. So we can verify, yes, employers can make workers get the COVID vaccine, but with a few exceptions.